Hello everyone! Today is what I call my Story Friday. I'm going to tie in this week's content with something currently relevant in my life. And we talked this week about how we need to work with the body to heal, and about how the healthcare system is so focused on labels and disorder mindset that it misses the patient experience. So my story today is about the perfect intersection of these two issues. And today I want to talk about the body telling you something is wrong, and the medical system dismisses it as being in your head. I want to talk about zebras. So in medical school, they teach students this. When you hear hoofbeats, think horses, not zebras. Meaning, look for the common diagnosis first, the statistically likely answer. And I understand that logic. But when that training produces a medical system that doesn't know what to do with people who are zebras who walk through the door. And I am a zebra. My daughter is a zebra. My son is a zebra. And I have several friends they are. And I had hundreds of patients. So for all you zebras, this is our story. So my story with EDS, Ehlers-Danlos Syndrome, and zebras started years ago with my daughter. She was 11 years old at the time. It was back in 2013. She was a cheerleader at a competitive private gym, and she was doing some heavy training. She sprained her wrist, and she had some other dislocations. But with this wrist injury, she was in so much pain, the coaches didn't believe her. They told her, you shouldn't be hurting that bad with this. And they labeled her like a crybaby or something even. But it was awful, but I believed her because I had been watching her body for years. The joints that moved too far, the hypermobility that looked like a party trick until it became a liability, the dislocations, the pain that didn't match what her x-rays showed. And me, my personality architecture, which we'll get to soon, is I'm an ENFP or a pathfinder, and I'm a nurse. So I see patterns in the holistic mind, body, spirit we all are. And besides her injuries, and some of the things my son could do with his hypermobility, I was seeing a pattern in myself that started when I was very, very young. I had dislocated my elbows, my shoulders, my finger joints. I had multiple knee dislocations. The joints of my fingers and my hips and my big toe pop out. Both my ankles have rolled over and been sprained so many times I stopped counting. But one was so severe that it broke the bone below my pinky toe. So I've been dealing with these dislocations and joint issues my whole life. When I kept dislocating my knees in college, because I was on the rowing team and we were doing some very heavy training, the multiple patellar subluxations pretty much ended my participation in that sport. I played water polo too, so I had to go in the water. But at the time, my parents weren't really particularly concerned about why I kept dislocating my knees. So I went to the ER and got braces, but I never got physical therapy or surgery, and maybe that's a blessing in hindsight. But I had braces, and I kept them, and I used other kind of braces and sleeves and managed my joint issues myself. But I really didn't have language for what the pattern this was and what was actually happening. So, my daughter's having issues with my wrist, and my son's a little older, but he had problems with dislocations too, and he could like manipulate his fingers in crazy ways that made people at parties stop and stare at him. And he had knee problems. He had a couple of surgeries on his knees. He had dislocations. So it's clear these dislocations run in my family. My sister had issues. I'm not sure which one of my parents might have had this, or grandparents, but I wasn't looking for it. But my daughter had a wonderful pediatric APRN that knew her since she was a tiny baby, and she was her primary care provider till she aged out. So since she knew her well, and she was very thorough and attentive, she was the kind of provider who actually really knows her patients. So she saw what was happening with my daughter, and she did what a good medical practitioner would do. She referred her out to a pain specialist or rheumatologist. So we went to the Dartmouth system, which is like a big medical center up here in New England, and it's very prestigious. And I really didn't know what we were going to find. I just knew something was wrong with my daughter, and I had a child in pain, and the coaches were giving us a really hard time, and I wanted to help her. So the specialist examined her, he listened, he ran the Baton score, the clinical test for hypermobility, and then he gave her the diagnosis. Ehlers-Danlos Syndrome, hypermobile type. I had never heard of this this was in 2013. So back then, the medical system was quite different, and it worked the way it was supposed to work. It gave us the name and the diagnosis, and he gave us, tips for taking care of her joints. And this all happened in 2013 because the APRN knew her very well, and the specialist had the knowledge to diagnose. Things were working back then. And my daughter was 11. She finally had a name for what her body had been doing. And then I also had the language too. So I started researching everything about Ehlers-Danlos Syndrome. And everything started clicking into place. So it's a connective tissue disorder. It affects collagens, tendons, ligaments, fascia, fat pads. It's the protein that holds everything together in our body. So there are many subtypes, but in the hypermobile type, which is the most common and the hardest to diagnose, the joints are simply too flexible, they move too much. The tissue that should anchor them doesn't hold the joint in place the way it's supposed to. And then I was looking at my own history. I looked at my kids, I looked at my sister. I was looking at friends, I was looking at patients. And I noticed in my ADHD patients, there was a lot of this. And so, if they mentioned dislocations or hypermobility, subluxations, it was like a cluster of symptoms I was starting to recognize. And it was everywhere once I had a name for it. I mean, not everybody has this, but it's a clear pattern when somebody does. So, the language. Just having a name for something changes everything. And now I know a knowledgeable provider is gold, who will take the time and listen to you. So when you find one who actually sees what's there, like the nurse practitioner or PA or doctor who knows you well enough to refer to you, the specialist who can name it, like this isn't a given now in modern healthcare in 2026. This is rare. So, but it matters enormously because the language is the first intervention. And for most zebras, it takes an average of 10 to 12 years to get the diagnosis and the language. 10 to 12 years. According to the Ehlers-Danlos Society and multiple research studies, consistent across the United States, the UK, Australia. This is not just an American problem. This is a Western medical system problem. And it is a gender problem too. A 2009 UK study found that men with EDS waited an average of 4 years for a diagnosis. Women waited 16 years on average. 16 years. It's the same condition, the same body's failing to hold together. 4 years if you're a man, 16 if you're a woman to get the language. That is not a diagnostic challenge. That is a systemic pattern of disbelief. EDS is estimated to affect somewhere between 1 in 600 and 1 in 900 people. But to be honest, that is a complete guess. A lot of people don't know they have it and they're not seeking care. The system doesn't want to diagnose it or count it or get the stats. But anyway, we know it's far more common than previously thought. And over 90% of cases remain undiagnosed or misdiagnosed. 90%. Not because the condition is so rare and 0.00001% of the population. Because the awareness isn't there. Because the symptoms overlap with fibromyalgia, chronic fatigue, anxiety, depression, neuroatypical diagnosis, and many more. All the wastebasket categories that end the inquiry. They'll just diagnose you with something to get you out and move on. And because there is no single lab test or genetic test for the hypermobile type. The diagnosis is clinical. It requires a provider who knows what they're looking for and takes the time to look and listen, which is exactly what the current medical system has the least amount of time for. So I also want to name something that took me years to put together. My kids and I also have ADHD and anxiety. I didn't know as much about ADHD back then in 2013. And the DSM criteria, because I worked in mental health, were built around the hyperactive kid who can't sit still. That didn't fit me, and it didn't really fit them. But the emotional part did, the anxiety, the dysregulation, the time blindness, the way everything coming in goes straight to the executive center at once, and you're overwhelmed. That all made sense to me when I listened to Russell Barkley, ADHD expert. I recommend everybody listen to, because he'll tell you what it actually is. So I understand now, from my own personality architecture, and the thing with me is my very strong intuition and abstraction picks up on everything in the field simultaneously. And the executive function part is something I can do, but it takes a lot of energy for me. It's developing, and it's not my primary strength, so it was never going to be my greatest gift, like some people have. And with my daughter, she has a very strong sense of morality and authenticity. The emotional world was coming on so strong for her. She has this abstraction too, and the dysregulation when the pain wasn't believed. The anxiety that came from a body that kept doing things bodies weren't supposed to do, and feeling the way she wasn't supposed to feel. She was, 13 and doing a lot of work, and it's continued. And she just got diagnosed with ADHD at age 23. We missed it earlier because the system's template didn't fit her. I actually had a friend tell me about, 8 years ago that I had it and I had it bad. So it took me time to find someone to treat it for me, and it took her years to find a psychiatrist that was available and would listen to her. I see that pattern constantly now, though, that EDS and ADHD are often presenting together. Neurodivergence and connective tissue difference showing up in the same bodies at rates that are not coincidental. We are not just people with two diagnoses. We're qualitatively different energy systems and bodies built differently. Our connective tissue is not typical. Our nervous systems process differently. We are zebras all the way down, mind, body, spirit. So, for me, to get a diagnosis, I started in 2015. I went to a rheumatologist. I was having severe pain and all sorts of health problems, what I now know is an EDS flare. And I told him I was a nurse practitioner and I diagnosed people for a living. I was in the system too and was competent and experienced. I brought my research, I explained the pattern, and he did the Bateman test in the office, and I met the diagnostic criteria. But, he says, I've never heard of this before. What's EDS? So I showed him the literature right there in the appointment. He looked at me, and he said, nah, I'm going to diagnose you with fibromyalgia. Not because the evidence pointed there, because fibromyalgia was the label he apparently had for women with pain that didn't show up on his scans, and he knew. And fibromyalgia is a real condition. It is a functional problem with the nervous system interpreting pain signals. There can be overlap with EDS and fibromyalgia. And also with fibromyalgia, there are no labs or scans to diagnosis. There are medications that can help it, and it can be studied, so that's a good thing that fibromyalgia patients might have some treatments. They can actually get the diagnosis that EDS patients do not. But fibromyalgia, unfortunately, has become one of those wastebasket diagnoses of pain medicine. Sort of it just ends the inquiry. We did the labs, we did the test, you got fibro. So, once it's in your chart, every provider after that reads that word and stops looking as well. They figure no labs, no tests, gave you anything, you have fibro. End of discussion. So over the next 8 years, I brought up my hypermobility and EDS to 15 different providers. I told them I was a healthcare provider. I didn't just Google this. My daughter had an official diagnosis. I had the records. It's hereditary. Talked to 15. Didn't matter. The responses were variations of the same thing. It says fibromyalgia in your chart. We don't like to diagnose EDS because people are Googling it and wanting the diagnosis. It's become a fad. I heard that from almost everybody. A fad. My connective tissue is a fad, apparently. And here's what I want to say to that. Again, my daughter's EDS was diagnosed by a pediatric rheumatologist in the Dartmouth system. This is a genetic condition, so one of her parents passed it on to her, and by my history, it was clearly me. I didn't put this pattern recognition together by simply doing a Google search. My daughter got the diagnosis from an expert, a physician with a clinical exam at a major academic medical center. The system diagnosed this condition in 2013. That is 13 years ago. And since then, the system started telling its own providers not to honor what the system had already established. That is not the patient's failure. That is the system failing its own patients. And one of my providers, after I pleaded with him for years, and he did the Baton's criteria too and wouldn't diagnose me, he did give me hypermobility NOS on my record. He ruled out Marfan's, and I was hypermobile, but he would not put EDS down. So I got hypermobility, not otherwise specified. And essentially, several providers told them management didn't want them to give out EDS as diagnoses, since there is no lab test or genetic test for the hypermobile type. So some providers use that reason to question whether it even exists at all. Even though several other EDS types do have tests, even though the clinical criteria are well established, even though the International EDS Consortium has published diagnostic guidelines that are very clear and observable. If you can't run a lab test, it must not be real. If the patient found the pattern herself, she must be catastrophizing this whole thing and just be anxious. If it doesn't show on the x-ray, it isn't there. So my daughter moved to Florida now. She's 23 years old. It's 10 years after her diagnosis. She carries her diagnosis in her charts and records, but the one confirmed years ago. And the doctors there are refuting it and saying they don't believe it's a thing now. So she had knee surgery with a surgeon who refused to believe she has EDS. He didn't understand, and the technical part is she had like tissue growth under her knee called a fat pad. He operated without understanding that and sent her to PT who didn't understand. So without accounting for what hypermobile connective tissue does when you cut it out, how it heals differently, how the surrounding tissue responds differently when the collagen doesn't hold the way it's supposed to. This kills me as her mother because her knee is now permanently damaged from a surgery that was meant to help her. She's only 23 years old, and now she's processing the grief of knowing that her knee will never be what it should be for the rest of her life. And that's not a small thing. And many of you with EDS have stories like this. So this is what happens when a surgeon operates on a zebra while believing he's treating a horse. And I want to talk about physical therapy for a minute, because this is where it gets personal and practical at the same time. I have been to physical therapy and seen multiple therapists. Some of those experiences ended with me getting hurt and just stopping it. Because a physical therapist who doesn't understand EDS will push you like you are typical. They will give you the standard protocols. They will not listen to you when your body tells you something is wrong. And with EDS, if you push through the wrong signals, ignore your body, you don't just have a sore muscle the next day, you have a crash. You have a subluxation. And that means you set yourself in your healing back weeks, if not more. But about a year ago, I did have one PT, and she was like fairly new, but she was a very caring person. And she listened to me, and she gave me interventions that actually helped. I'm so grateful to her. She let me tell her what my body was feeling, and she adjusted. She wasn't an expert on EDS, but she believed that I could tell her the experience of my body and my own joints, and it was valid clinical information for the treatment plan. So she was very effective for me, and I have done amazingly well with that and a few other interventions. So the goal with EDS, physical therapy, is not increasing flexibility because you already have that. The goal is more stability, and she got that. So it's building the muscular support around the joints that don't stabilize themselves. Proprioception work, teaching the nervous system where the body is in space. Because EDS proprioception is genuinely different. The signals are there, they just arrive differently. And then the pacing, learning your energy envelope, not pushing through. Because pushing through with EDS produces crashes that take a very long time to recover from. And my daughter is post-op, and she experienced this recently too. The PT she was seeing didn't understand her body and wouldn't listen to her. So after everything she's been through, that is a particular kind of exhausting. Now at the same time she's having surgery in PT, I had like a pretty good experience up here by comparison. And she had injured her knee, I injured my foot. So I want to tell you about what happened with the podiatrist I saw, who was great. It really helped me, because this story needs someone who got it right too. So my daughter and I were on a trip, and we were in Croatia, and the sidewalk like fell away, and I rolled my right ankle completely over and fell. So I had significant soft tissue involvement on the right and an obvious sprain. But then, because I wanted to stay active and enjoy our trip, my left foot got overused and took a lot of punishment. So when we got back, I started having severe pain in the left foot. It got so bad over a couple months, I couldn't even walk without severe pain. So I just stopped moving, basically. I walked as little as I could, and I got very, very sedentary. That had other problems later. So I eventually broke down and saw a PA for the visit. I wasn't expecting to be taken seriously. And she did x-rays, and she said, I have no idea what to do with you. Your bones are fine. But she did listen, and I said, I do have hypermobility NOS, which came in handy, and she said, yeah, I see that. So I said, it could be soft tissue. So she said, okay, I'll refer you to a podiatrist, because the pain was still there, and I could hardly walk or move, and was using a cane. So she referred me to a podiatrist. So I had to wait a month to see him, but it was worth the wait. So he really examined me and talked to me. He looked at the joints on my feet, all of it, my ankles, and he said, simply and clearly without drama, all of your joints are hypermobile. You have a connective tissue disorder. It wasn't a question about what was real or not. He didn't tell me it was a fad. He didn't just keep his face buried in my chart and look at exams and the x-ray. He didn't think, oh, she just has fibromyalgia and stop listening to me. He listened to what I said. He looked at my body himself. He did the exam, and he saw what was there. So he told me it was an issue with the connective tissue under my feet, the fat pad. So he couldn't give me a pill and fix it, but he also said, okay, here's a treatment plan that will work for you. He told me to wear inserts, to ice it, to rest it, and let the fat pad heal. He told me to get strong running shoes that provide the structure. He knew exactly what to do with someone with EDS. And you know what? That helped. It took a little while to heal, and he said, come back if it doesn't in 8 weeks or so. But I waited the 8 weeks, and it healed. That was all I needed. Someone to actually see what was there and tell me something true about it, and a good plan. We also talked a little about something that clicked for me in that conversation, like a framework I've been building about the 3 layers of the human system. Like there's mind, body, spirit, and there's lots of 3s and things. So the bones are our structure. That's our framework. That's our architecture. The muscles are the force. That's what moves through the structure and like carries us in the world. And then the fascia and the connective tissue, that's like the spirit that's between them. That's a tissue that connects everything to everything else. It connects the skeleton to the muscles. That transmits force across the whole system. That holds the relationships between the structure and the power. There's all these, beautiful holographic panoramic things and triads. So you can see the bones on an x-ray. You can see the muscles on the MRI. But the fascia, the connective tissue, that lives in between. And that's harder to scan. And that is the relational tissue. And you cannot assess the relational tissue with the scan alone. You have to examine. You have to listen. You have to believe that the patient who is telling you what is happening to them and living in their body is a valid source of information about what is happening to them. That's the art of medicine that we seem to have lost in our for-profit system. So, in 25 years of psychiatric nursing, I saw a particular kind of wound that doesn't have a clean name in the DSM. And I started calling it like a spiritual medical trauma. But I want to be more precise about medical trauma. Because what I was seeing in my patients, and what I experienced myself and my family and friends have, wasn't just trauma from a bad procedure or a frightening diagnosis. It was something more specific. It's like this spiritual abuse, when the medical system repeatedly tells you that your perception of your own body is wrong, that your pain isn't what you say it is, that the pattern isn't real, that the years of attention you've paid to your own signals have produced nothing reliable for them. It doesn't just deny your treatment, it severs you from your own ground of being. Your body is the most immediate territory of the self. Managing a chronic condition is a meaning-making project. You are learning the language of your own body systems. You are building a relationship with your limits, your signals, your patterns. And wanting to know things is not hypochondria. It is trying to gain embodied wisdom. So when an authority figure with power over you and your well-being tells you systematically, for me, across 15 providers, across 8 years, that your perception of your own experience is wrong, coercive control, gaslighting, the nervous system does not experience that as just a medical disagreement. It experiences it as what it is. The same message many of us have received since childhood. And the theta download, things like you're too sensitive, you're exaggerating, it's only in your head. So that subconscious programming that Lipton talks about, that was installed in theta, ages 0 to 7, before we evaluated any of it. We already believed these things about ourselves. And then later, the medical system walked in and gave that programming institutional confirmation. I saw this in my patients. I saw it in people around me. I have a friend who's hypermobile too. She was recently exhausted, dealing with SIBO, chronic pain. She finally got an EDS diagnosis, but she couldn't get a geneticist in all of New England to actually confirm what her body was already telling her. And she had concerns because her dad had died young of a rupture, and so she was worried she might have the vascular type of EDS. But the system couldn't help her. So she did what zebras do. She took care of herself. She found her own way. Last time I saw her, she was looking great, and I do hope she's feeling great too. Then I have another friend who works on her feet all day, reaching. She's had hernias and back problems. So I told her about EDS a couple years ago, and she happened to see a doctor who was aware of this very quickly and confirmed it in her chart. But then to get the treatment to help her, she spent the next year fighting for insurance authorization to see some specialists who could actually do surgery that wouldn't damage her and would actually help her. Fighting for the care she already knew she needed, for the surgery she already had been told she required. And she's a fighter by nature, and she advocates for herself the way some people just breathe. But not everyone has that in them, especially after years of being told their body's signals can't be trusted. Especially when the theta layer, the subconscious beliefs, are already running that program. The medical trauma isn't just in the chart, it's in the nervous system. And the medical system, particularly since lockdown, has had less and less capacity to see what it's doing. It's worse now, but this kind of abuse in how the medical system treats patients has existed for years. I saw it in hundreds of patients in my practice for the last 10 years I was practicing. I saw them come in, and they're in shutdown or fight flight sympathetic and crying in my office because a doctor had yelled at them and they didn't know what to do. So I saw it in my EDS patients, and my chronic pain patients, and patients with any sort of complex presentation that didn't fit neatly into the billing codes. So think about it. What happens to a person when they go into the system in real pain and are very vulnerable in genuine real pain, and the system tells them it's not real? They tell them it's anxiety. You're being catastrophic. And if you're not getting better as a patient, it's because you must not be compliant. So it's your fault that the interventions we gave you didn't work. So the system intervention fails, and then the failure becomes your fault. Loop. And many providers taking insurance in the medical system have no time and no bandwidth to deal with zebras. They're exhausted. I talked with a colleague who said all primary care providers that she knows are on SSRIs within like 4 or 5 years of going into the work because it is so stressful and it is exhausting them. And it's worse since the lockdown. So, if your problem isn't a horse with a simple fix, you are on your own. And for zebras, this is reinforcing every belief that was already loaded in from childhood. Your pain isn't real. You're too sensitive. You're making this up. Your body's signal can't be trusted. You can't trust your body, and they certainly don't. It's horrible. Those beliefs were already there in so many of my patients and friends and me. And the medical system walked in and just confirmed them without realizing the harm it was doing. And there's another ethical problem here, because I took coursework in underserved populations, and this is one, and I have to name it directly. The providers who understand EDS, who take the time to learn it, to do the clinical exam, who believe their patients, to actually do good quality work, they have to set up like boutique practices, essentially, to have the time it takes to do this. But that is private pay, out of network, and it's expensive. Because insurance doesn't reimburse for the time it takes to actually examine a connective tissue disorder or anything complicated. So if you have EDS and money, you can find care. Or sometimes you get lucky and you find someone in the system. Rare though. And if you have EDS and no money, you are navigating this alone. Well, not alone, because there is community, because the zebra EDS community has built it. There are websites, there are community forums. With whatever you can piece together from the resources, the medical system refuses to acknowledge as legitimate. I had patients who were in state-level EDS support groups or ran them. So the medical system has abandoned the zebras to grassroots organization. And the zebras, being zebras, built something anyway. We think outside the box. The EDS community online is extraordinary. People sharing what works, people translating the research, zebras finding each other, zebras finding the clinicians who know what a zebra looks like. That community is not a fad. That is people with a real condition doing for each other what the medical system refused to do on the whole. So the zebras. If you found this video because you are a zebra, or because someone you love is a zebra, I want you to hear this directly. You are not imagining it. Your body is telling you something true, and you can trust it. The pain is real. The fatigue is real. The proprioception, like knowing where you are in space, that feels different. And it causes other problems, because if you have proprioception problems, you might more easily fall and dislocate or hurt yourself. So all of that is different. It's not just anxiety. It's just not being a catastrophic person without any problems. You're not a hypochondriac, and this is not a fad. This is your connective tissue doing what your connective tissue does. The medical system's inability to see it is a failure of the system, not a failure of your body. And if you are trying to get a diagnosis here, this is the most important thing I can tell you. Get the language and advocate for yourself. Even doing that, it's an uphill battle. But learn the Baton scores. Know the diagnostic criteria for the type of EDS you may have. Go to the appointments with the vocabulary, because the language is the first intervention. And you can buy yourself braces. You know about ice and rest, because you finally know why your ankle keeps rolling or why things keep popping out. So the real intervention is outside structure. Interestingly enough, for ADHD, scaffolding in the environment is also a key intervention. So with these connective disorder issues, it's scaffolding. It's building the outer structure that's not in your body. You need to pace yourself, because now you understand your energy envelope. Like, learn yourself, and that's a real intervention. Only you know it. And find a PT who will listen to your body, even if they're not an expert, but someone who respects that, and leave the ones who won't. That's a real intervention for yourself. You do need, so hear this, you do not need a provider to validate your experience before you can act on it. You have been living in this body your whole life. You know it better than anyone else. You are the expert. You know it better than anyone who has ever quickly examined you. So do your own research. I always tell people that. I always have. So look at the forums, learn in the support groups, on the zebra communities online. They are full of people describing experiences that may match yours or be similar. They share what has worked for them. They translate the research into plain language. That information is real. And also, weigh everything with a grain of salt though. Because every zebra's stripes are different. We are all beautiful snowflakes with different stripes. What works for one body may not work for yours. The forums show you the range of experience, not the prescription for your specific pattern. Remember, you are the expert of your own body. The research and the community give you more vocabulary for what you already know. So, I hope this helps EDS people, or with anybody who's a zebra, not necessarily with EDS, but any sort of complicated condition where the medical system has failed you. Anybody who's experienced that medical spiritual abuse kind of trauma. I was a psychiatric nurse for over 25 years, so I'm building this whole channel because I worked inside the systems, and they weren't big enough for what I was seeing. So my story, and those I love, and people who I have met over the years, all our stories with EDS are ongoing. And I carry fibromyalgia and hypermobility NOS on my chart after a battle. 2 diagnoses that took years of fighting to accumulate. And here's the thing. Even hypermobility NOS helps because it validates that something real is happening in the connective tissue. Not just a nerve dysregulation issue, it's that too, and it's not just fibromyalgia. And honestly, all those things may be related. If you look at proprioception, the nerve signals that tell you where your body is in space, those are different in EDS, like I said. And the nervous system dysregulation that shows up in fibromyalgia and IBS. The gut that runs too fast or too slow, with serotonin and acetylcholine not transmitting the way they should. These may all be the same system expressing differently in our bodies, because we are zebras. And the pattern of our stripes is infinitely varied. So my daughter is 23 and grieving a knee that a surgeon damaged because he didn't believe her body. My son has joint issues too. I'm still dealing with my own health issues, and we are all still navigating. But at least I have a podiatrist who looked at my feet and told me the truth about what he saw. And I have a framework now for understanding my own body as something more than a collection of symptoms that the system doesn't have time for. The fascia is what's in between the muscles and the bones. It's the spirit in between. The connective tissue is the relational tissue. It lives in the in-between. It holds everything in relationship to everything else. You cannot scan the in-between. You can only examine it, listen to it, believe the person living inside of it, believe yourself, believe your body. That's what I'm here trying to do. So take care of yourselves, and I'll see you next Friday.